Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Extrahepatic manifestations of the hepatitis B and the C. So here in hepatitis B, let's look at hepatitis B. So in hepatitis B, the hematological is that it is aplastic anemia. So it is aplastic anemia. And looking at the renal, it is going to have the membranous glomerulonephritis and the membranoproliferative glomerulonephritis. So in terms of membranoglomerulonephritis, it is that the hepatitis B is slightly over the hepatitis C. Next, let's look at vascular. So under vascular, the polyarthritis nodosa is present. Here also, it is B greater than C. Now let's look at the dermatologic. So under dermatologic, there is presence of the erythema multiforme. Here also B is greater than C. Next is the presence of the urticaria. Then there is a serum sickness as well. Infantile papular acrodermatitis. This is nothing but the Guillain-Barré syndrome. Then there is presence of the erythema nodosa. Now let's move on to the hepatitis C. So here in terms of Hep C, hematological, there is essential mixed cryoglobulinemia. So there is presence of mixed cryoglobulinemia. And what about renal? Renal, as we saw, there is membranoproliferative glomerulonephritis as well as membranous glomerulonephritis. And vascular, there is leukocytoclastic vasculitis. There is leukocytoclastic vasculitis. And what about the dermatological condition? Under dermatological conditions, there is erythema multiforme. There is sporadic porphyria cutaneous strata as well as lichen planus and the necrotic acral erythema. To learn and grow daily like this, please do subscribe.